Let's dive into some of the essential terminology and concepts used when discussing cancer chemotherapy. Understanding these terms is crucial for grasping the pharmacological activity, especially concerning efficacy and toxicity. One important term is the therapeutic index. This is typically defined as the ratio between the toxic dose and the therapeutic dose for a drug. However, for most cytotoxic chemotherapy drugs used in cancer treatment, the therapeutic index is more of an abstract concept. This is because the dose administered is generally based on the maximum tolerated dose, or MTD, rather than being derived from a dose-response assessment focused on efficacy. The MTD is an empirically derived value. It represents the highest dose of a specific drug that can be given to a limited sample population without causing unacceptable or irreversible side effects. This is a critical concept in cancer drug administration, as dosing decisions are predominantly based on this MTD value, rather strategic assessments of efficacy based on dose. A newer concept, particularly relevant for signal transduction inhibitors and molecularly targeted agents, but not exclusive to them, is the biologically effective dose, or BED. The BED is based on a measured response at a putative target or surrogate marker that is linked to the drug's mechanism of action. Using the BED concept might be valuable when applying cytotoxic chemotherapy with dosing protocols that aren't strictly based on MTD. We also need to understand dose intensity, or DI. DI is a measure of the dose per unit of time. This metric allows us to compare different dosing schedules, such as administering a drug every 3 weeks versus every week. Comparing DI can help determine whether the total dose of a drug or the dose intensity itself is more related to toxicity or the therapeutic outcome. It also highlights how altering dosing schedules can impact the outcome. When combining 2 drugs or combining chemotherapy with radiation therapy, we often evaluate therapeutic gain. Therapeutic gain quantitatively describes any improvement in tumor response relative to any increase in toxicity in normal tissues when these agents are used in a planned schedule. A positive therapeutic gain is achieved when the additive or synergistic effects on the tumor are greater than the summative toxicity patterns observed in normal tissues when combination therapy is used. Beyond these quantitative terms, there are concepts describing the timing and purpose of chemotherapy within a treatment plan. Adjuvant therapy involves chemotherapy given after the primary tumor has been surgically removed or controlled by radiation. Its purpose is to treat any occult disease, cancer cells not clinically detectable, and usually involves systemic drug exposure. Primary or neoadjuvant therapy uses chemotherapy before other modalities, typically surgical removal of the primary tumor. Thank you, and please like, share, and subscribe as proceeds created from this channel are donated to animals for specialty care.